Hi, today I want to talk a little bit about neuromodulators, which are injectables that we use in cosmetic procedures to try and improve the appearance of the upper face and other parts of the face. They decrease the muscle action that can cause wrinkles, and we can use them also to kind of shape parts of the face. Um, the most common type that people are aware of is Botox, but there are other major companies that have produced other of very similar products that are used for the same purposes. The other brand is Xeomin and Dysport, and the newest one is Jeuveau. So Botox is the first one, and that's the name that people are most knowledgeable about. And it's basically kind of like the Coke brand, and it's tried and true. And this is the one that's most commonly used and that most injectors have the most comfort with. Um, it takes about 3 or 4 days to work and lasts about 3 to 4 months. As with all of them, the amount of effect you have is going to be dose dependent, and certain people need more than others depending on how powerful their muscles are or how much wrinkles they have in their skin. Xeomin, in my experience, works very similarly to Botox. Again, takes about 3 or 4 days to work and lasts about 3 to 4 months. It has a reputation of being somewhat cleaner, people say, or maybe almost like organic. It's not exactly organic, but people that are into organic things sometimes tend to want to choose the Xeomin product. Dysport does have some differences. It can work a little bit faster. Some people say it even works within a day of injection, but a lot of people also say it doesn't seem to work quite as long as the other neuromodulators. Typically stops at about 3 months. Jeuveau is the newest one, and it has the reputation of working about the same as the Xeomin and the Botox products. But because it is newer, it is sometimes priced a little bit at a lower cost, and that might be attractive to clients. In general, all of these products are pretty similar, and I think people tend to have good effects with them. I've used them all, and I think patients tend to be happy with them. But sometimes patients seem to get a better result with one versus the other, and therefore I think it's not a bad idea to try each of them. The neuromodulators, they require maintenance, and it's something that people are going to be using over time. And just like when you go try a toothpaste, you might find one that works better than the others. They all seem to work pretty well, but you might get what you like out of one more so than the other. And with time, you might focus down on one